This channel serves to educate and inform, yet it doesn't replace expert medical counsel. Remember, your medical queries and concerns should always be directed to a professional. Diagnosis, treatment, or any health-related advice? Seek the wisdom of your physician or a qualified health provider. Let this be a springboard for learning, not a substitute for professional guidance. Dive in, absorb, but always consult with the experts for your health matters.
Do you know what gestational diabetes is? It's a condition that causes blood sugar levels to rise during pregnancy. This might sound alarming, but it's more common than you'd think. In fact, it affects up to 10% of pregnancies in the United States alone. Gestational diabetes typically appears in the second half of pregnancy and is often a silent visitor, going unnoticed unless specifically looked for. It's like an uninvited guest who arrives at your party unannounced, blends into the crowd and leaves without saying goodbye. But here's the thing, just because you can't see it doesn't mean it's not there. Gestational diabetes is very real, and it's important to be aware of it. It doesn't just affect you, but it could potentially impact the health of your unborn baby too. Now that we understand what gestational diabetes is, let's delve into its symptoms. So what are the symptoms of gestational diabetes, you may ask? Well, it can be somewhat elusive as it often doesn't present clear symptoms. This silent nature of gestational diabetes is what makes it a bit of a hidden menace. However, some women might experience increased thirst or a more frequent need to urinate. Unexpected weight loss despite eating more can also be a sign. In some cases, women may notice that they are feeling more tired than usual or that their vision is blurry. These symptoms can be easy to overlook or attribute to typical pregnancy changes, which is why regular checks during prenatal visits are essential. It's important to note that these symptoms don't necessarily mean you have gestational diabetes. They could be the result of other factors, but if you're experiencing any of these signs, it's crucial to discuss them with your healthcare provider. They can arrange for the appropriate tests to rule out or confirm gestational diabetes. Remember, it's crucial to keep an eye on your blood sugar levels during pregnancy. But what are the normal blood sugar levels during pregnancy? That's a question on the minds of many. Let's delve into it. During pregnancy, your body naturally allows your blood sugar levels to be slightly higher than usual. This is because your body is working hard to ensure your baby gets the right amount of glucose needed for development. The normal fasting blood sugar levels during pregnancy should be less than 95 milligrams per deciliter. After meals, your blood sugar should be less than 140 milligrams per deciliter, 1 hour post-meal, and less than 120 milligrams per deciliter, 2 hours post-meal. It's important to remember these are general guidelines and individual targets may vary based on several factors, including your age, weight, and overall health. Regular monitoring of your blood sugar levels can help you and your healthcare team to manage your pregnancy effectively and ensure your baby's well-being. Understanding the causes of gestational diabetes can help in its prevention. So what causes gestational diabetes? Let's dive right in. Gestational diabetes is a condition characterized by high blood sugar levels that develop during pregnancy. Understanding its causes and risk factors can help us take preventive measures. One of the main causes of gestational diabetes is hormonal changes during pregnancy. As the placenta nurtures the fetus, it produces high levels of various hormones. Almost all of them impair the action of insulin in the cells, raising the mother's blood sugar. As the baby grows, the placenta produces more of these hormones, making it even harder for insulin to do its job. Now let's talk about risk factors. Certain factors can increase a woman's chances of developing gestational diabetes. Being overweight is one of them. If a woman's body mass index, or BMI, is above the normal range, it can put her at a higher risk. This is because excess fat can make it tougher for the body to use insulin properly, leading to insulin resistance. Next, we have family history. If a woman has a parent or sibling with type 2 diabetes, she may be more likely to get gestational diabetes. This indicates that the condition can have a genetic component. Age is another risk factor. Women who get pregnant later in life, specifically over the age of 25, are more likely to develop gestational diabetes. And finally, certain ethnic backgrounds are associated with a higher risk of gestational diabetes. These include African American, Hispanic, Native American, South Asian, and Pacific Islander ancestries. It's important to remember, though, that any pregnant woman, regardless of these risk factors, can develop gestational diabetes. That's why routine screenings during pregnancy are so essential. Now that we know the causes and risk factors, how do we diagnose gestational diabetes? How is gestational diabetes diagnosed and treated? Let's dive right in. The diagnosis for gestational diabetes typically happens between the 24th and 28th week of pregnancy. During this time, your healthcare provider will conduct a glucose challenge test. You'll drink a sweet liquid, and an hour later, your blood will be drawn to measure your blood sugar levels. If these levels are too high, you'll undergo a glucose tolerance test, which involves fasting, multiple blood draws, and more sugary drinks. Now let's switch gears to treatment. The primary goal in treating gestational diabetes is to keep your blood sugar levels in the normal range, ensuring both you and your baby are healthy. This management typically involves regular monitoring of blood sugar levels, adopting a balanced diet, and engaging in physical activity. Monitoring your blood sugar levels is essential. Your healthcare provider will guide you on how to test your blood sugar levels at home. This allows you to keep track of your levels throughout the day, helping you make informed decisions about your diet and activity levels. Speaking of diet, eating balanced meals plays a significant role in managing gestational diabetes. To maintain your blood sugar levels, you'll need to consume the right mix of proteins, carbohydrates, and fats. Consulting a dietitian can be incredibly helpful in creating a meal plan that suits your needs and preferences. Lastly, staying active is another crucial part of treatment. Regular physical activity can help you control your blood sugar levels and maintain a healthy weight during your pregnancy. This doesn't have to mean heavy workouts. Even a brisk walk or a short swim can do wonders. Remember, each pregnancy is unique, and the treatment plan that works best for you will depend on your specific circumstances. Your healthcare provider will work closely with you to ensure the best possible outcome for you and your baby. Let's discuss some complications that can arise from gestational diabetes. What are the complications of gestational diabetes, and how can diet and exercise help? When we talk about gestational diabetes, it's important to understand that it's not just about the mother's health, but also about the baby's. Complications can arise if gestational diabetes is not managed well. For instance, the baby may grow larger than normal, a condition known as macrosomia. This can lead to difficulties during delivery, increasing the likelihood of a C-section. The baby may also experience hypoglycemia or low blood sugar right after birth. In some cases, there's a risk of the baby developing type 2 diabetes later in life. For mothers, uncontrolled gestational diabetes increases the risk of high blood pressure and preeclampsia, a serious complication that causes high blood pressure and damage to organs like the liver and kidneys. Now, let's shift gears and talk about diet and exercise, two key components in managing gestational diabetes. A healthy diet is crucial in maintaining blood sugar levels. This means opting for whole grains, lean proteins, fruits, and vegetables. Sugary snacks, sodas, and processed foods should be avoided as they can cause your blood sugar to spike. A registered dietitian can help design a meal plan that meets your nutritional needs and keeps your blood sugar under control. Remember, it's not just about what you eat, but also about when and how much you eat. Exercise, on the other hand, can help lower your blood sugar levels by encouraging your muscles to use sugar for energy. Regular physical activity like brisk walking, swimming, or prenatal yoga can make a big difference. But before you start any exercise regimen, always consult with your healthcare provider. To sum up, gestational diabetes can lead to complications for both the mother and the baby. But with a healthy diet and regular exercise, these risks can be significantly minimized. We've discussed the complications, but what about the effects on the baby? How does gestational diabetes affect babies, and how can we prevent it? Gestational diabetes can have a significant impact on babies. During pregnancy, if a mother's blood sugar levels are high, this excess sugar can cross the placenta, causing the baby's pancreas to produce extra insulin. This overproduction can lead to a condition known as macrosomia, where the baby grows too large, potentially resulting in delivery complications. Additionally, babies of mothers with gestational diabetes are at a higher risk of developing type 2 diabetes and obesity later in life. They may also experience low blood sugar and jaundice after birth, requiring special care and monitoring. But don't despair. The good news is gestational diabetes can often be prevented or managed. Maintaining a healthy weight, adopting a balanced diet, and staying active are key. Regular prenatal checkups and blood sugar monitoring can also help manage the condition effectively, ensuring the best possible outcome for both mother and baby. And finally, will gestational diabetes lead to type 2 diabetes? Does gestational diabetes increase the risk of type 2 diabetes? You might be wondering. Indeed, it does. Women who've had gestational diabetes are more likely to develop type 2 diabetes later in life. This risk can be as much as 7 times higher than for women who did not have gestational diabetes during pregnancy. It's important to know this, not to scare you, but to emphasize the significance of managing your health during and after pregnancy. Let's do a quick recap of what we've learned today. Gestational diabetes is a condition that can affect pregnant women, typically in the second half of pregnancy. Factors such as being overweight, having a family history of diabetes, and belonging to certain ethnic backgrounds can increase the risk. The good news is, with regular monitoring, a healthy diet, and staying active, it can be managed effectively. Remember, awareness and timely action can help manage gestational diabetes effectively. Stay healthy, stay informed.